we would be looking at it actually from two perspectives. The first actually is having a better understanding of the natural history of this particular illness and disease. When we started out managing COVID-19, we didn't understand a lot about what this was, and there was a difficulty deciding, therefore, was the course of events, the nature of the illness going to be more like SARS, which we had a deep and personal experience of, or was it going to be something like influenza? And it was clear at that point in time, while we had the capacity and capability of doing so, it would be prudent for us to admit all patients with confirmed diagnosis of COVID-19, then continue to look after them in the hospital, and then only think about returning such recovered patients back into the community when we are absolutely sure that they are not shedding any more virus, there's no possibility of any infection of other people in the vicinity of these patients. But as time goes on, we have a better understanding of the natural history of this illness. We've come to realize that there is a significant group of patients with a mild course who are very well, who in fact are staying therefore in the hospital almost as if this was a hotel or some other accommodation, because they actually have no need for significant nursing care or treatment. And we are keeping them on the basis of wanting to make sure that they are test negative. And this is the same experience in many other countries where they are also looking at large numbers of patients coming in, being treated with COVID. And therefore, it leads us then to think that as our understanding of the natural history of the illness deepens, as we have a better grip on what this illness is all about, we are coming to a realization and understanding that perhaps not all these patients actually need hospital care. And if they do not require hospital care, then obviously that is a better thing. It helps, therefore, to make sure that the care we provide for them is appropriate for their needs. This is irrespective of what the numbers are, but it's just an understanding that many of these patients do not need to stay in the hospital. That said, it is important, though, if we return these patients into the community, or if they were diagnosed already in primary care without needing them to come into hospital, we do need to put in place measures such that even if they have a diagnosis of COVID-19, there is no concern or risk of spread to other people in the community. And therefore, some attention then needs to be paid towards how we would allow them to isolate themselves in the community, or if they're not able to do so in their homes, then to provide them with an option where they can safely stay in the community without any risk of spread to others. And these are measures they're working on. And it's not just in Singapore. These are considerations that many other countries are doing. You know, you may be familiar with news reports from the UK, where one of their ministers, a health minister, in fact, was coming down with COVID-19, and she was in fact recovering and resting at home, not even in the hospital. So this consideration of perhaps not necessarily needing to admit all patients is something that many of our health authorities internationally, we're starting to consider this. There may be an additional concern if the numbers increase, where there may be then perhaps some concern about wanting to make sure we maximize the potential of our hospital beds, our ICU beds, to look after increasing numbers of patients with COVID-19. Thankfully, we have not reached that stage. However, we are making plans to safeguard our resources and capacity and capability for that possibility in the future. And that includes making sure that we have adequate resources, equipment, manpower, beds, as well as an ability now to provide additional numbers if needed, if the numbers come up. So in short, we're looking at it very holistically. This is not a reactive strategy just because we are worried about the possibility that numbers will go up, but it's in fact also on the basis of a better understanding of this illness and a realization that not everyone needs to be in the hospital.